Hi friends, I have the honor and pleasure of having with me Dr. Aishwarya Rathod, rank 49, AIIMS May 2018.
Yes.
Heartiest congratulations.
Thank you so much, sir. Thank you.
So, how are you feeling today?
I am feeling extremely good after पूरी internship and 6 महीने की मेहनत. I finally got what I wanted.
Finally, the journey is now, coming to the
Exactly.
end. है ना?
Exactly. New phase of life.
Yes. And we're so proud to share with you that she joined us for her second year in for the foundation program
Yes.
with us, and then
Yeah.
she followed it up with a test and discussion
Yes.
this time for
Yes,
the
sir.
AIIMS exam.
Yeah.
And how was your experience overall with the classes?
The entire experience with Dam's family was extremely awesome. I mean, I am extremely grateful to the entire family for helping me get what I achieve. I owe a lot of my success to sir, you, ma'am, and the entire family.
So how did it all begin when you entered DAMS for the first time as a second prof student?
Yes, sir.
Was it like a eye opener that okay, there's a world of competition?
Exactly. When you are in your college, you do not realize there are a lot of things which are different in the competitive universe that are not taught in the institute. So when I joined DAMS as a foundation course in 2015, I realized that there are a lot of conceptual things, a lot of things which need to be learned outside the arena of the institute, and which DAMS was able to provide to me that year.
So any particular teachers or subjects that you remember from those years
Oh,
that
yes,
were
yes.
which made a difference
Definitely.
at that time?
In foundation course, pharma, micro, and biochem, I was not well versed with those subjects. I was extremely scared, but when I came here, the concepts were strong, so it was very easy to remember once you are strong with the what are the basics. So which happened here, and so I could easily remember after that. So I'm very happy that I attended that course.
And how was your experience with the test and discussion this time?
Extremely necessary to have achieved what I achieved today, because let me tell you one thing, there's one thing that I've realized, that tests are one of the most important part of the entire studying methods that you use, because unless and until you don't give the tests, you do not realize what you know and what you don't know. And that is why I joined this course, and I realized that there are so many things that you learn just from the tests, which probably you might not remember even after reading just the basic notes.
Were you happy with the format that you give a test, then the teachers come and discuss, and they not only discuss the question, they try to bring the entire subject to you in that limited
Sir.
hours?
It was extremely good because not only the question but the concept around the question was covered. So any question which comes from the similar concept in the exam, you are able to answer it because you just don't know the question. You know the concept and the reason why it is behind it.
Do you feel the questions and the quality of questions that we create in DAMS are reflective of the real exam?
Extremely. In fact, there are few questions which directly came into the exam from the DAMS TND. So I was so happy. It did not take me even 5 seconds to answer that question. The concept was clear. The question was already seen. So that was one of the reasons I could get this rank.
Any particular teachers that you want to mention today in
Oh,
this day of your
definitely.
success?
I need to thank at least a few teachers. First of all, you, sir, for teaching me radiology and making the subject so interesting by adding clinical knowledge to it and an approach to it. Deepthi ma'am for an amazing AIIMS discussion, for amazing conceptual discussion, and there was a question directly in the paper, and I was so elated to see that question. Diksha Sikri ma'am, not only for her amazing pathology skills, but also for her motivation and sidewise posts on the group. Also, Rohan Khandelwal sir's notes and the Bailey updates. There were literally questions which directly came from those updates and the last minute updates. So that, and Tushar Mehta sir's orthopedics. Like orthopedics is not one branch which is easy for me to learn, but sir made it extremely interesting and easy to remember and conceptualize.
Did you also utilize the testing platform that we use, the grand tests and the videos after the grand test? Did you utilize that facility? And
Yes,
did you,
sir.
Were you consistent in giving the full course papers?
Sir, I've realized that right now ventures are extremely important if you are trying to appear for an exam, especially AIIMS, where you need concepts. So you need to take as many tests as possible in the DAMS app and the eMedicos app. And the videos, there are videos also after those tests. So if you've not understood some question or concept behind it, you see that video, you understand the entire thing. And taking grand tests is one of the most important thing. Please do take as many grand tests on the app as possible and see those explanations on the video. Like if you've seen those explanations, it is settled in your head and you can easily answer the questions with concepts, not just by rectification or remembering the questions.
So what I personally feel is that people sometimes they miss out on the chance to give a full course paper.
Yeah, sir.
While actually the real exam is going to be full course.
Yeah.
And that is the key skill actually to how to
Definitely.
think biochemistry at one moment and then go to forensic at the second moment, then
Exactly.
go to medicine, then come back to
Exactly.
biochemistry.
Exactly.
Because otherwise what happens is people keep giving the subject wise paper and they miss out on the real thing, and so
Because
you have to kind of keep doing both the things.
exactly.
Grand test.
Subject, obviously, it is important to understand the subject and do the questions. But unless you've taken a grant test, it's difficult. कि वो time management कैसे करना है? How to go from one subject to another? There are so many things in a while taking a test which are important. Your calmness, the way you approach a question, and then you just some certain questions which you don't know, leave it and go to the next question. Those are the skills which are required along with the knowledge while taking a paper, and you can develop those skills if you are taking a grant test along with the subject tests.
I also, we have just updated our test series app. Are you happy with the interface?
Definitely, sir. Definitely. I mean, the interface of the app that right now after the updated app is extremely good. It's so much easier to find your tests, the subjects, the videos, and like all the notifications, the settings, your profile, everything is so clear.
Thank you for your feedback.
Thank you so much, sir.
And I also want to know from you that based on what you have done this year and how you have performed in the exam.
Yes, sir.
And you've given the AIIMS exam.
Yes, sir.
Do you want to mention some topics or some tips for somebody who wants to be in your place in November?
Yes,
you want
sir.
to say something about the exam preparation,
Surely.
specifically AIIMS?
Surely. Sir, one thing I always say is smart, skillful, and repetitive studies is one of the key to successes. Like, you need to revise and re-revise topics. Obviously, you need to do the past year questions. They are there in the app, ebooks wala app, and you see the past questions. You see that there are certain topics which are always repeated in the AIIMS paper. You do the entire topics and clear your basics. It's not just about remembering. Even biochem, even pharma, micro, you see the images, you learn from those images, you keep following the app, you keep following the Facebook group, and you will realize that there are certain things which are asked in the exam definitely. And if you are well versed with those topics, especially in gynae, especially in path, there are certain topics which are constantly repeated. There are certain images which need to be seen like on the last day. Forensic, a very high yield subject, please do that subject very nicely, and there are 5 to 6 questions which are directly from those subjects. So there are certain things to be kept in mind, especially for the AIIMS exam.
Did you utilize you were mentioning utilize the Facebook group interactions, and were you happy with the way teachers were all the time discussing with the students? It was a
very interactive
school kind of environment, and did you enjoy that?
I was quite dependent on that group for solving my queries, for constant motivation, for constant updates. Facebook group is actually a very nice way to be in constant touch with the subject, because you don't know the updates that are going to happen tomorrow or day after, and AIIMS depends on those questions. They actually asked the FDA approved new drug in 2017, and it was there on the group, so it was quite easy that way.
And I also want to know from you is we conduct special workshop or revision sessions for AIIMS.
Yes, sir.
What was your experience? Were you happy that we could put in a nutshell the things that are being asked? And I also want you to tell me, did you utilize the previous AIIMS paper that we had put on the app
Yes,
so that
sir.
you could revise in the end? So
Definitely. So past year questions are one of the most important things, because they'll give you an idea about what can be asked, and there are directly 3 saal ke paper on the app, so it was so much easier with the solutions. You don't have to go look in a book, you don't have to go see online. So there are questions with solutions, one particular subject, and the entire of them compiled in one place. So it makes it extremely easy, and I definitely use those. And I attended the AIIMS discussion like just 1 to 2 weeks before the AIIMS paper, and there were like PSM, radio, anat, and gynae. There were certain questions, even surgery. There were certain questions which were like usi concept say in the paper 2 weeks later. So predicting those questions and making us understand that these topics are important, and revising them 2 weeks before the exam was quite useful for the paper.
So my vision of that course is usually I tell teachers that let's do a crash course, and in which we try to put high yielding things, push, tell them,
Yes,
one,
definitely.
2, 3. If it is about emergencies, then tell them this emergency, procedure like that. So because we you may not imagine the kind of discussions that we teachers have. We are sitting with the surgery teacher, and I'm sitting, and gynae we are sitting like, what will you do? What will I do? It's like it takes a lot of effort to do such sessions.
Definitely, sir.
And similar thing that we do in DVT in the
Yeah, sir.
So I feel very happy when you mention it, because that makes our efforts validated, and I'm sure all the teachers listening to you today are also feeling very happy and proud that okay, at least because they put in an extra effort here, because
Obviously,
to teach
sir.
in 3 days is easy, but to put it in 2 hours,
Is
we have to
extremely
work very hard.
yeah, effort taking, yes sir. DVT also, for that matter, like there were certain images which were directly from the DVT, so if you just revise the DVT in like 2-3 hours, it can be done because there's a direct compilation. Then it would be a lot easier to revise those images, and there are a lot of image based questions which are coming in the AIIMS exam now, more and more so with forthcoming years.
And plus AIIMS per se, as compared to all other exams, the visual questions are more in AIIMS than other exams. So you
Definitely,
have
sir.
to keep an eye open for AIIMS.
Yes, sir.
So, and visuals.
Yes, sir.
So, and any other advice you want to give to future AIIMS aspirants?
Keep working hard. There is no exception to hard work. But please, please, please do revise in the last month. Revision is the most important thing when it comes to any exam. You can study till the last month, but you have to revise all you've done. Please revise the DAMS notes. Please look into the app. Please look into DVT and all the updates that are there on the Facebook group. Those last minute points really help in the exam. And it has helped me. So I'm saying from my personal experience. And please keep working hard.
Any final line to motivate people?
There's role of luck, but that luck also depends on hard work. So don't think ahead, don't overthink, just keep working, and there's destination waiting for you, and just keep working hard.
On that note, I would like to add that that luck factor evens out in the long run.
Definitely,
I
sir.
can be unlucky once, but I can't be unlucky every time. I can't be lucky every time.
Definitely,
it evens
sir.
out.
Yes,
And
sir.
that's a beautiful point that you've mentioned here, and you summarized everything in a nutshell. You don't think that I'm lucky, unlucky. You work hard, create your own luck. With this
Exactly,
note, we
sir.
sign off, and we congratulate her, her
Thank you so
parents
much.
on
Thank you
this
so much, sir.
awesome achievement in life.
Thank you so much.
Congratulations.
Thank you so much.